Good morning, everyone. I'm Sarah, together with my group mates Cheong, Iliana, Musab from Group B, under the supervision of Prof. Asma, will be presenting about acute labyrinthitis today. Labyrinthitis is an inflammatory disorder of the inner ear. Inflammation of the perilymphatic spaces will eventually result in secondary changes within the membranous labyrinth. There are three types of labyrinthitis. First is circumscribed labyrinthitis, second is diffuse serous labyrinthitis, and finally diffuse suppurative labyrinthitis. These are the two common etiologies that contribute to acute labyrinthitis. First is bacterial or viral infection. The common causative organisms are Haemophilus influenza, Streptococcus pneumonia, and Epstein-Barr virus. Second etiology is trauma to the labyrinth. These are the common clinical features of a patient with acute labyrinthitis. The common clinical features are high-grade fever, vertigo, reduced hearing, tinnitus, ear discharge or ear blockage, nausea, and vomiting. For history taking, it's important for us to inquire about the details of the symptoms presented on the patient. For example, for vertigo, we should ask about the timing and duration, association with movement, head position, and other characteristics. For hearing loss, we should identify whether it's unilateral or bilateral, as well as the duration. We should also look for any signs of oral fullness, tinnitus, otorrhea, otalgia, nausea or vomiting, high-grade fever, neck pain or neck stiffness, any preceding or current upper respiratory tract infection symptoms, as well as any visual changes.
For the physical examination, we start with checking the vital signs such as blood pressure, pulse rate, and temperature, especially tachycardia, which is common in acute labyrinthitis. Ocular examination is done to observe for nystagmus, which usually present in labyrinthitis. We need to examine the ear by doing otologic examination, which involve external inspection, ear canal inspection, tympanic membrane inspection to look for any sign of acute otitis media and acute mastoiditis. Tuning fork hearing test is done on the affected ear to check for any sign of hearing loss. Complete ENT test together with neurological examination such as cranial nerve examination to look for any nerve involvement. Pure tone audiometry test is a gold standard for determining the type, degree, and configuration of hearing loss in patients. For hematological investigation, a full blood count is done in a patient with acute labyrinthitis. Blood culture and sensitivity testing are performed in patients that are not responsive to preliminary antibiotics. For radiological investigation, we use high-resolution computed tomography of temporal bone, which is HRCT, as labyrinthitis is a potential complication of acute mastoiditis, which cause damage to middle ear and inner ear. So we can observe in the radiological examination there is opacity of the mastoiditis.
For the complication of acute labyrinthitis, it can cause mastoid abscess, extratemporal abscess, meningitis, and brain abscess. For the management, we can give IV fluid for rehydration, analgesia, antipyrexia, broad-spectrum IV antibiotic that can cross blood-brain barrier to treat the underlying diseases such as severe allergic rhinitis and uncontrolled diabetes. For surgical intervention, we can do mastoidectomy for labyrinthitis, secondary to mastoiditis and cholesteatoma. For our take-home message, there are three types of labyrinthitis. The cardinal symptoms of acute labyrinthitis are otalgia, fever, reduced hearing, tinnitus, and vertigo, and labyrinthitis can be diagnosed clinically. Here are our resources. Thank you.